Hi, I'm Dr. Suprada, urogynecologist and cosmetic gynecologist at Akkineni Hospitals, Vijayawada. Let's take a look at some important insights today. Please stay engaged and make notes.
Welcome to this explainer. Look, if you've ever felt completely frustrated by a postpartum belly that just won't go away, no matter how hard you hit the gym or dial in your diet, I really need you to hear this right now. The changes your body went through are highly likely structural. We're not just talking about stubborn fat here. Today, we're going straight to the science. We're going to look under the hood at the pathophysiology of the postpartum core, the actual biological reasons your abdomen changes, and precisely how to manage your recovery based on the evidence.
Okay, let's dive right into this. 60 to 70%. That is the percentage of postpartum women who experience abdominal laxity and sagging. Seriously, if you're dealing with this, you are absolutely not alone. In fact, it's the reality for the vast majority of mothers. It's an incredibly common condition, but it's kind of swept under the rug, leading to a lot of quiet distress and misunderstanding. Well, we're going to change that today by figuring out exactly what's happening to the body.
So, here's our roadmap for today. First, we'll cover the postpartum reality. Second, the anatomy of diastasis recti. 3, why it's more than just aesthetics. 4, conservative recovery strategies. And 5, when surgery actually makes sense.
All right, Section 1, the postpartum reality, the physical demands of pregnancy.
During pregnancy, your abdominal circumference expands by an astonishing 15 to 25 centimeters. Just take a second and think about the sheer mechanical force of that. Your skin has this remarkable elasticity, right? But during pregnancy, it essentially acts like a rubber band that gets stretched way beyond its natural limit. This dramatic, sustained expansion literally disrupts the collagen and elastin fibers in your skin. And to make matters even more complicated, pregnancy hormones are actively suppressing collagen synthesis at the same time. This means your skin's ability to bounce back is significantly impaired at the exact moment it's being stretched to its absolute physiological max.
Moving right along to Section 2, Anatomy of Diastasis Recti, Understanding the Separation.
So, what is technically happening structurally? It's called diastasis recti abdominis, or DRA for short. Basically, this is the separation of your rectus abdominis muscles, your front six-pack muscles, along that midline connective tissue called the linea alba. During pregnancy, hormones, particularly one perfectly named relaxin, increase the laxity of this connective tissue so your uterus has room to safely expand. Because of this totally necessary biological process, this separation happens in nearly 100% of women by the third trimester. It's just a completely natural, unavoidable feature of late-stage pregnancy.
But here is where we draw the clinical line between a natural, temporary thing and a condition that actually needs some dedicated intervention. A normal gap between those muscle edges is less than 2 centimeters. However, if that separation is wider than 2 centimeters, and, this is key, it persists beyond 6 months postpartum, then it's clinically considered abnormal. For about 30 to 60% of women, some degree of this persistent separation sticks around long after childbirth, which really messes with your core stability. So why does it persist for some folks and naturally resolve for others? Well, let's look at the risk factors. Cumulative effects play a huge role here. Multiple pregnancies progressively alter that abdominal structure, making full recovery a bit harder each time around. Age is definitely a factor too. Maternal age over 35 is linked to naturally lower collagen production and just less skin recoil. Plus, a high pre-pregnancy BMI, gestational weight gain exceeding 15 to 20 kilograms, and carrying a baby over 4,000 grams, which is roughly 8.8 pounds, all of these severely increase that extreme stretching, which predicts much greater laxity down the line.
Section 3. More than just aesthetics. The functional and psychological impact.
And this brilliantly illustrates that we are talking about way more than just cosmetics here. A weakened, separated core cascades into your entire body. Structurally, that gap between the muscles completely robs the abdominal wall of its normal support. That's what causes that protruding central bulge, especially when you're working out or even just tensing your stomach. Without that core strength, women often suffer from reduced exercise capacity, like struggling with high-impact stuff or just daily lifting. It also destabilizes your spine, hello chronic lower back pain. Plus, it directly contributes to urinary stress incontinence because those weakened muscles aren't properly supporting the bladder neck. And finally, we absolutely cannot ignore the mental side of this. This condition deeply impacts body image, confidence, how your clothes fit, and just your overall quality of life.
Okay, on to Section 4, Conservative Recovery Strategies, Healing from the Inside Out.
Now, what's really interesting about this next point is that it definitively busts one of the biggest fitness myths out there. When we want a flatter stomach, our very first instinct is to drop down and do crunches, right? Well, actually, scratch that.
If you have diastasis recti, traditional crunches can actively worsen the condition. They put intense outward pressure right on that already weakened midline. Instead, proper clinical rehab completely flips the script. It's all about activating and progressively strengthening your transverse abdominis. Think of these as the deep core muscles that wrap around your torso like a built-in natural corset. Working with a specialized physical therapist to target these exact muscles, that is the absolute gold standard for non-surgical healing.
Now, rebuilding deep muscle and healing connective tissue takes time, for sure. It requires progressive resistance. If you start a structured rehab program, here's a pretty realistic timeline. Week 1, you start with gentle core work, really just to reestablish that mind-muscle connection. But you've got to stick with it, because it usually takes about 8 to 12 weeks of dedicated effort to actually see meaningful functional improvement and a visible reduction in that bulge. Then, looking at months 6 to 12, you're just optimizing those conservative measures, often pairing them with healthy weight management to reduce the overall volume of tissue contributing to the issue. So, you might be thinking, what about belly bands or corsets? Listen, compression garments and abdominal bracing are fantastic for temporary functional support. They definitely improve how you look in clothes, and they help you feel a lot more stabilized when you're moving around or lifting your little one. But here's the catch. They do not fix the structural issue. They don't magically heal the underlying muscle separation or tighten up that tissue laxity. Think of them as a highly useful temporary bridge while you put in the rehab work, but they are not the final destination.
All right, final section. Number 5. When surgery makes sense, the role of abdominoplasty.
Let's honestly compare what physical rehab can achieve versus what surgery can achieve. Conservative rehab is phenomenal for improving muscle tone and building deep core strength over a couple of months. But if you're dealing with significant excess, stretched skin, or a remarkably wide fascial tear, rehab simply cannot magically fuse that tissue back together. And that is exactly where abdominoplasty, commonly known as a tummy tuck, comes in. Surgery physically removes the redundant skin, it repositions the tissues, and, crucially, it involves something called fascial plication. Basically, the surgeon literally stitches those separated rectus muscles back together to reconstruct your abdominal wall. Keep in mind, this is a major procedure. It requires general anesthesia and a serious 2 to 4 week recovery period. But for women with moderate to severe laxity who just haven't seen their desired functional or cosmetic results from physical therapy alone, the success rates for surgical intervention are honestly incredible. We are talking about a satisfaction rate of over 90%. The results of an abdominoplasty are dramatic. It comprehensively addresses both that functional core weakness and the external appearance. And the best part is, these results are highly durable. They last indefinitely.
However, surgery requires really precise timing. You absolutely cannot rush into this. There are strict prerequisites. First off, you've got to wait at least 6 to 12 months postpartum, sometimes even longer if you had a vaginal delivery with extensive trauma, just to allow your body to naturally heal and stabilize. Second, you must have completely finished breastfeeding, because your breast tissue changes postoperatively and your hormones really need to balance out. And third, and this is arguably the most important, you must be completely done having kids. If you get pregnant again, you'll just stretch all those surgically tightened tissues right back out and completely reverse the results.
Now, if you are currently planning future pregnancies and you want to be proactive about minimizing these structural changes, the data points to some very clear prevention strategies. Building really strong abdominal muscles before you even get pregnant better equips your body for the extreme physical changes ahead. Maintaining your gestational weight gain within your doctor's recommended ranges significantly cuts down on the sheer mechanical stretching your skin and fascia have to undergo. And finally, starting appropriate specialized postpartum rehab early, usually around 6 weeks postpartum once you get the green light from your doctor, optimizes your recovery trajectory right out of the gate.
We have covered a tremendous amount of ground today, looking at the undeniable biological realities of the postpartum body. Whether your specific path involves dedicated physical therapy or eventually consulting a surgeon for a fascial repair, your true power lies in understanding your own anatomy and the science behind it. So I'll leave you with this final thought. Looking at all the facts we've explored today, what are your personal recovery goals? And which evidence-based step will you take first on your journey to restoring your core? Thanks so much for joining me on this explainer, and I will see you next time.